Good morning, everybody. This is Todd and Tori with Evolve Health and Wellness, and this is going to be the first part of many podcasts that we're going to be doing addressing extremely important topics that come across related to general health and wellness, related to sexual or intimate wellness, hormonal wellness and stuff. But we felt, and it just came out yesterday, something that's just widely important to men, and the FDA convened a testosterone panel of experts that discussed men's health, specifically related to testosterone, low testosterone, and just the stigma and the problems that men face on a day-to-day basis trying to get just generalized care. And we feel that it's just so important because it's part of our core service here, things we're already doing here at Evolve Health and Wellness, but we just wanted to emphasize, share with you guys some of the takeaways. And Tori, I know, has a lot of discussion about this. So tell me what you think about that.
So yesterday, the FDA did convene, and what they are really looking for is to remove the age-related criteria associated with testosterone therapy. Now, currently, testosterone therapy is used for hypogonadal men. That really only attributes to about 10% of all men. I love that the expert panel was up there yesterday. They went over trial after trial that basically stated that testosterone therapy is safe. There is no increased risk of cardiovascular disease, prostate cancer, and the overall health and wellness of men has been undermined for years.
And what I think was the most important part about this was the takeaway that testosterone is not a lifestyle medicine. It is not just to make you look better, vanity, in the gym. Many studies have shown that, you could take testosterone, and if you're not working out, you're not going to get these results. So it's part of a tool in a toolbox, even to the part that when they emphasize the study-related deficiencies that low testosterone has on a man and the negative outcomes, I think that was profound.
Okay, so I can reference 3 trials that they talked about quite often. One was the Traverse trial. There was over 5,200 men, and the design of this trial was to prove that testosterone therapy did not cause cardiovascular events. And out of that trial, in fact, if anything, the cardiovascular health improved. There was also the T trials. T trials were men that were greater than 65, and they were looking at longevity for men. Did they improve longevity? And absolutely, they did get a modest improvement. But the biggest trial for me, Todd, when I got to really listen to it and dive in, was the T4DM trial. This was designed for metabolic health for men and the reduction of type 2 diabetes. What's your thought on that?
Men with low testosterone have a 40% increased risk of developing type 2 diabetes. That is profound. In today's day and age, the metabolic problems that we have due to our diet, due to our work schedule, stress, our sedentary lifestyle, now you compound that with low testosterone levels and you see these results on top of the osteoporosis risk, on top of the worsening cardiovascular risks, on top of the lack of muscle. Muscle is the number one indicator of longevity, meaning the more muscle you have, doesn't mean you have to be a bodybuilder, but the more muscle you have in both men and women is a direct correlator into longevity. And testosterone is amazingly important as part of that. And this is what we talk about in both men and women.
No, absolutely, for sure. And we do know that testosterone, with testosterone going down over the years, there's been an increased risk of cardiovascular disease. And with that increased risk of cardiovascular disease, we also see metabolic health. Metabolic health is bidirectional. So if men are obese or if men have cardiovascular problems, they don't want to get up, they don't want to move, they're more sedentary in life. And in doing that, it changes their family dynamics at home. They don't want to do as much.
Testosterone, we need to get past the stigma that it's a lifestyle medication. Hey, I just want to feel cool. I want to be around my friends. It's not. Testosterone, we see upwards of 68% increased risk of Alzheimer's, dementia, mood. It's part of a family unit. When hormones are optimized, you have both men and women loving each other more. A man can be that provider that we want to see, that can be a role model for their family. They're just not living this sedentary lifestyle. We hear stories of, I just don't function well at work anymore. It's just so much more than just a lifestyle and a bravado or a vanity type of a medication. And what I really like was, and it's I don't want to call it comical, but they're talking about developing a men's health initiative, using testosterone early in life. Start looking at it as part of a cardiovascular or metabolic health early. We do triglyceride levels, we do cholesterol levels, we look at A1C and fasting blood glucose and fasting insulins as early as 18, 20 years old. Knowing that testosterone is so vitally important to metabolic health, why aren't we just doing even just a baseline testosterone level, which we know here at Evolve Health that's only part of the picture, but at least get a baseline so as you age, you can see these changes just as you would with a cholesterol level, because it's that vitally important. It is one of the most important markers of metabolic health. And I really like to see that push from the federal government. Granted, that could take many years, but we're already doing that here. So that's why I think we're so profoundly capable of taking this to the next level.
I think the next thing I'd really like to talk about is actually prostate health. Also with testosterone therapy, there was a stigma for many years that testosterone therapy itself caused prostate cancer. And actually this all stemmed from one person in the 1940s. I believe his name was Dr. Higgins, and he was a professor, and he had one patient, and in 18 days, this patient developed prostate cancer. Was this related to testosterone? They have debunked this for years, but yet the stigma is still out there that testosterone therapy causes prostate cancer. There is study after study that basically says that this is not true at all.
And if you believe and listen to the study, and we kind of joke that Dr. Abraham Morgentaler, who is the leading expert on prostate cancer as it's related to testosterone, said, and I quote, "If you believe prostate cancer is caused by testosterone therapy, you believe in the tooth fairy." And he said this on the FDA panel. It is that profound of a joke nowadays that it does not cause prostate cancer. We know this, we understand this, but it's still one of those stigmas that are vilified in the testosterone replacement world, meaning a man feels and has all the symptoms of testosterone deficiency, goes to his primary care provider, and they're literally, men have come in here and said, they tell me I'm going to get cancer because of this, or I'm going to die of a heart attack or stroke with being placed on testosterone replacement therapy. So we understand this. I'm glad to see that the FDA is taking this to the next step, and sort of uses the federal government to help underscore what we're already doing here to involve health and wellness.
You know, it's really been great that in February of 2025, the FDA did remove the cardiovascular risks associated with testosterone therapy, but did add that it can increase your blood pressure, and still left the fact that they wanted testosterone for age-related use only. Now in December of 2025, they still left that on there. I do think that Men's Health Initiative is huge out there, and that will be removed.
And as these changes take place, we've already seen it on the women's health side, we've seen it on the men's health side. I think it is important to have a men's health initiative to really address the fact that men die earlier and sooner and more frequently than women, and that needs to be addressed in testosterone replacement therapy, as well as diet, lifestyle, exercise, which are key components here at Evolve Health and Wellness, that we take this seriously. And I think that's what this big push was for. Make it part of a global change in men's health, and base our treatments on the science and not just on some hogwash you might hear on social media or whatever. These are study-related, evidence-based goals that now the federal government is coming on board with, which just sort of validates even more and puts a better stamp on what we're already doing. Because men are so underserved. The millions of men that seek treatment and just can't find it for reasons that just aren't founded in science. It's fear, it's training, it's old, outdated information. I think some of the newer providers tend to find or are a little bit more open to clinics like ours, as we have a collaborative model with other providers. And I think that what you see is they're starting to become more open. The men are going into surgery now, and in the past, stop all hormones, and now they're coming out going, you don't need to really worry about that. Some newer providers are understanding that. But you're still going to find providers that are scared to treat it because they just don't know or understand. And, even if this does make a big change, the difference between us and other providers is that we go to 8 conferences in a year. They may have done 8 hours in medical school training. So even as this changes, they're still going to be, afraid to treat. They're not going to fully understand the nuances of dosing and treatments and not blocking estrogen, as opposed to what's a safe level and what's unsafe. correlated with hormones. There's just so many nuances besides just writing a prescription. And these are some things that maybe you can get into why we're a little bit different than other providers being a cash-based model, and we're not restricted by some of these handcuffs that are from the insurance company.
I think right now, because insurance-based models are still, testosterone is for age-related hypogonadism. This isn't just always a thing. Todd, we've sat here talking about the fact that testosterone therapy can help reduce type 2 diabetes, improve cardiovascular, improve metabolic health. And absolutely, libido is fantastic with that. This is what we take into account here.
And even beyond that, many of you know my history, and something that hits home to me is in the fire department, police, fire, military, they have such high suicide rates to the point that it's tracked, and the VA publishes data on the suicide risk. A lot of it's attributed to PTSD. I was diagnosed with PTSD. I believe it was a hormonal issue, and we see this over and over again. And this is, and I'm talking directly to the people that are watching this that might be like, you know what, my husband's a firefighter, or my wife is a police officer, and they're starting to notice depression and anxiety and these withdrawn type of affects. And we know that neurological diseases are extremely complicated, but we also know that many of these disease processes are helped by optimal hormone levels, including testosterone. As I discussed before, 68% of men that are hypogonadal have increased risks of Alzheimer's, dementia, and depression and anxiety. So something to think about there. It's just multifaceted. And if you're considering coming to us for a clinic, hey, I think I might have this. What are some things that might be triggers that people come out and say, you know what, I think I might need to see Evolve Health and Wellness because I think I have some of these issues.
I'm developing truncal obesity. I have no energy, no motivation. I'm worried about my anxiety is just all over the place. I'm not sleeping at night. Let's look for the root cause.
And I think to expand upon that as well, Tori, is the intimacy with your partner. If you feel that you're becoming distant, you or your partner are becoming distant, we love having couples come in here and talk about their issues as well. We've had our own issues that have been resolved by hormones and improving diet, lifestyle, and exercise. These are all things. So if you have even just a question, we'll do a consultation with you and just to basically go over basics. If you want a discovery call, is this right for you? We do a comprehensive approach. We look at labs. We look at what you're eating. We put you on our scales to make sure that there's a whole bunch of things that we're not going to miss. Because again, testosterone and even hormone optimization overall is just a tool in that toolbox to really help round out general health and longevity.
Todd, just to add on to that, there was a statistic that just recently came out that said 50% of all divorces happen around 45 to 50 years old. Why is that? It's our hormones. Hormones are fluctuating all over the place. I love that we like to bring couples together. We like to see people, and we really want to address this with somebody.
To summarize this whole podcast, we need to focus on addressing hormonal health in both men and women. There's a lot of initiatives for women. I think this underscored the lack of treatment that is in modern medicine. Now, clinics like ours, we do this day in and day out. We've been doing this for years, and we study it, we research it, we go to classes. We understand it in and out. This was a push that is being done because of the new administration is really focusing on health and wellness. And so they're making some really big changes, and they're addressing the problems that happen, root cause problems of what happened. And this was focused on men specifically. And it just underscores that, guys, it is not just a lifestyle medicine. I can't say that enough, because testosterone replacement is vilified as toxic masculinity. What is that? Toxic masculinity as bodybuilders. There is abuse. But that was the other part that they talked about. Just a quick side note that, why is testosterone the only naturally produced hormone in existence that has a DEA category or Schedule 3? Caffeine is more addictive than testosterone. However, caffeine, you can go next door to the bakery here and get a coffee, but you can't get testosterone replacement therapy.
Testosterone is actually categorized with ketamine. Think of it that way.
Yeah, it's just been vilified. But that was from in the 1980s when people didn't really fully understand testosterone, and there was a large abuse of it in the bodybuilding and athletic and performance enhancement world. But then again, I understand some controls on that, but to have it scheduled where it makes it such an obstacle. And I think, again, this going back to men's health, the FDA is coming out trying to say, or at least the panel was saying, hey, we need a change to help men to feel better and live longer and generate family bonding that we should have. We are living longer. Why, let's have the quality of life that is commensurate with that longevity.
Yeah. It's how do you choose to live your life?
Correct. So I just want to say thank you. Again, this is Todd and Tori, practitioners with Evolve Health and Wellness. It's true and near and dear to our heart because we have friends and family that we've seen turn their lives upside down. Personally, we've had our lives turned around. We really appreciate the panel of experts that are trying to get the FDA to change the labeling and make it more expansive, just to break through some of these hurdles. We prescribe it frequently. We understand it. This is more for global change nationwide to just kind of take a better understanding of testosterone in men.
Thank you, everybody, and have a good day.